Let's do a quick mic check. February 22nd. And I know this started at 2:22 Pacific Standard Time. I'm in Utah right now. But the important thing is we're going to launch on this day not only because, let's do a quick mic check. It is February 22nd. Okay, so the sound is working. But today's presentation is going to be health starts in the mouth, right? The mouth is part of the body. And this really has to do with, my business partner now that I've been working with for over 3 years. Before I was working in this industry, I never thought I'd really work in dentistry, or I should say oral health care, because the first words that she sat down and said out of her mouth was that dentistry is dead. And mind you, I had just flown over from a different state and really dropped 3 different businesses to come and listen to her presentation about what she's doing with dentist, and the first words out of her mouth is dentistry is dead. So I just wanted to make sure I wasn't wasting my time. And for any of you, this isn't just for dentists out there. Actually, this presentation is for anyone that has teeth, right? Anybody out there that has a mouth, that has teeth, and that is interested in living well, living healthy, and living the good life, right? Everyone talks about that white picket fence or the American dream here in America, or in other parts, living healthy, having good circulation, having good sleep. But it all comes down to general, or I should say optimal well-being and general, health, right? So I say too now that dentistry is dead and oral health care is the future, and there is a reason why. And I think that after this very short presentation, you're going to agree that oral health care is the future as well. So I apologize. Let me make sure these are on mute here. So, and you can do these searches as well, but if you go in and type in the top 10 reasons for death 100 years ago and now, right? Because if you look, and let's just do that right now, how much spending for medical system, or healthcare system, I should say, right? So trends in healthcare spending and healthcare. Okay, so we're getting about the same numbers. I just wanted to do a quick check. So, we're looking at healthcare spending in the trillions of dollars, actually, right? $3.8 trillion. It says it's increased 4.6%. And actually this number, I've seen numbers up to about 8 or even 9, almost increasing to $10 trillion now. Because these numbers are quite old, and this is a global problem. The last 2 years has not just, slightly increased these numbers. It has dramatically doubled, tripled, and exponentially grown sectors of this overall health spending. So what we have now is we have this situation that we've spent, $900 billion in just Medicare alone, and it is the single largest line item in our government or in our nation. If you think about it, it's even more than our military easily by about 3 or 5 times, depending on how you calculate the numbers. So we are talking a behemoth as far as, not just how much money is going through here, which is easily calculable, but how many lives this affects. We call it the healthcare system. So there's a lot of things that, come with that, right? There's a lot of expectations, and there's a lot of preconceived notions, some of them right, some of them wrong. I think the biggest one, because it's called healthcare system, is that we all assume that every bit of this system is perfect and is interested towards health, right? But actually that word health is the biggest confusing point, I would say, of the system itself, because although it is called a healthcare system, and that is one part of it, overall it is a system, and it is a system that is more designed for profit, or to manage services for, the 360 million plus people here in the US alone and beyond, right? So systems are not necessarily designed for optimal health. Systems are designed to, make things easier, to duplicate things, for different applications. But point is, what I wanted to kind of get down to is looking at our system of healthcare. And I'm not an expert, right? I'm not a doctor, but my point here is, if you listen to me, you don't need to be. I've been spending the last 3 years working in the dental industry, and I guess for all sakes and purposes, I've been serving as the leader and innovator in the space for oral healthcare, as we call it. There's been a lot of people in the dental industry. There's been a lot of people in the medical industry. But there's very few people that have combined the two. And I'm going to just say it very simply like this. I believe that the health starts in the mouth, right? And I believe that the mouth is part of the body. And what I mean by that is, for me, we eat, breathe, drink, and not just talk, but communicate and connect using our mouth, right? Not just literally, like romantically, but, like through communication, we connect. We're very social creatures, right, as humans. And so the health starting in the mouth, I believe, is the critical point and underlying, let's call it, we're going to use this big word called philosophy, right? But it's the underlying fundamental. It's the first point that we all have to agree on, that health starts in the mouth, right? And if you don't agree on that, that's fine. If you'll just stick with me here and be a little patient, I think you'll understand why. And two is that mouth is part of the body. For many of us, and I hope for everybody, that is a obvious statement, but you'll see why in our healthcare system, those two statements completely fly in the face of everything that we do in our healthcare system. We have a complete divide in which we treat anything on the other side of this invisible line, right? On the outside, from the outside to the inside of our mouth, there's this, if you were to draw an invisible line and call it like the vermilion border, that's that invisible border that doctors cannot and MDs will not cross in like an operating room or an emergency room. No matter how far the patient is about to die, they will continue to just prescribe that patient, antibiotics, or go to surgeries outside of that vermilion border when every bit of every evidence is pointing towards the source of that problem being from the mouth, right? So that's what I'm getting to here, and it's not in every single case, as we're going to find in the statistics, but this is a very large number. And being that we are, let's see, how is the U.S. ranked in world healthcare? And I'm doing these, I know I searched a couple of these before, but I'm doing this intentionally just to show like that I'm not making these up. If you actually just look online, you can find this as well. So United States is ranked 6th in healthcare. Oh, that's actually a lot better than I had seen before. So what I had seen is that countries by healthcare quality. Okay, so let's see, where is the US? 5. Okay, so we have a very good survival rate. Now it's interesting that we're not, because of our spending, in the top 1 or 2 or 3 at least. I would think that we are, but we're doing not so well in like heart attack, and hemorrhage stroke is down to 16. It's getting a little bit worse. Ischemic stroke is a little bit better, but point is like we're not in the top 1 or 2 or 3, but you'd expect us to be, right? Based on the amount of spending and the amount of technology and science that we have here in the U.S. But anyway, so what I went to do is I actually, searched for the top 10 reasons for death 100 years ago and now, and what you'll come across a few articles, but I just clicked on this Atlantic article, and it has a chart, just because this one is the most clear. There's a lot of different ways to, draw this information, but this specific article says what killed us then and now. So the New England Journal of Medicine, they actually went through 100 years of history to produce this picture that we see here. And what you're going to notice is very interesting, at least for me, is you see so many different areas that do not affect us, big now. I mean, I know tuberculosis, at least on this chart, it used to be a huge problem, right? Based on number of deaths out of 100,000 deaths, tuberculosis, gastrointestinal infections, cerebrovascular disease, these were all very big problems. Pneumonia or influenza was a very big problem then. So you have all that going on, and now you have everything has gone down except for two. But if you'll see, cancer hasn't just gone up a little bit, it's gone up a lot, right? It's almost tripled. And with heart disease too, I mean, we've seen heart disease dramatically increase as well. So the big question you got to ask is what's going on here, right? What's going on when you look at the deaths 100 years ago to now, and after $900 billion in just Medicare alone, but really we're talking about several $1 trillion in spending, annual spending a year, we would at least think that we would get these numbers down, at least these two, right? Or at least that's my thinking. And so what I started to do is I started to do some research, and this got very personal to me because a little bit before I got introduced to this project, or I got invited to work in this project, I lost my father, and I lost him way too early, I think. And now reading this book and meeting this Dr. Thomas Levy gave me a lot of insight, because, I mean, to be quite frank, I was very shocked. I was upset. I was frustrated. I was angry. I mean, my dad, he was prescribed some medication from his doctor, for his high blood pressure, for his cholesterol, and he had type 2 diabetes. And the doctor had prescribed him this medication and was getting to the point where he was giving him the green light that he was able to return to a healthier regimen and was able to come off of the medication. But, my dad had been complaining about a toothache or pain in his jaw, I should say, in this, mouth area. And the dentist, a lot of the times, if there's not a very serious concern, or many cases, if you're going to the same dentist that put in the root canal, and in my dad's case, he had at least 2 root canals, and I mean, he had two root canals, but I'm thinking that they were infected, right? Because he was complaining about pain. But we have, the reason why I bring this up is because this is something that we see, and not just 20 or 30 or 40 or 50, but we're talking like 60, 70, 80% of the working population in some cases, and especially in the Medicare or the 65 and older population and the elderly population, we're talking about 90% or more of patients out there that have infections, or they have some kind of issue going on. It's a medical issue in their teeth, their gums, their tonsils, sinuses. And so after I read this book, the Hidden Epidemic, it talks about the silent oral infections that cause most heart attacks and breast cancers. Now, cause is a very strong word, but he was a doctor. He was actually a cardiologist, a heart doctor, and he went on to get the JD after his name. So he's not just a doctor, but he's also very well versed in the law. So being a lawyer and a doctor, he knows exactly, what he can and can't say, and he has the proper research to prove. I mean, actually, some of these pictures that he shows, when they say a picture's worth 1,000 words, I mean, it's very clear, because you can actually see these x-rays when they back up. So when you see the mouth, you can just see the pictures, problems in the mouth, and then when you take an x-ray of the heart or the chest cavity, you only see the the issues there. But when you like back up and you zoom out and you see the whole picture, and then you notice, oh my goodness, all of the infection or that periodontal, disease is draining down, and it's creating a second, what they thought was an origin, but is creating a second site, for cancer based on that original site. Well, then, we all know what the cause is, right? There's no question about that. But the reason why I'm bringing this up is because we still now, till this day, when we have all this amazing computers and, AI, we're talking about VR, we're talking about augmented reality, which, I mean, some of those are big words that we're all talking about like right now. But even if you remember 3 or 5 years ago, nobody was talking about this. Even geeks and nerds weren't talking about VR and AI and NFTs and blockchain. But now it's like a common language. It's almost like something you have to know. But the reason why I bring that up is because all of that is a distraction to me. It doesn't matter how much technology you have. I'm not here to convince you that technology is only going to make you less connected and all that stuff, which I believe there are some good arguments for that. But either way, the point of this conversation is with all of this technology and advancements in healthcare, none of that matters if we ignore the mouth as part of the body, and that we do not all agree that health starts in the mouth. So if we cannot agree that the mouth starts in the body, I mean, I don't even know what to say to that, right? It's just anybody that has eyes or that has a mouth themselves can understand that the mouth is clearly part of their body. But the important thing when I say that health starts in the mouth is that you can not only include the mouth, or I should say all of the mouth, as part of health, as part of a proper healthcare regimen, but it's necessary, it's required. Actually abandoning it and leaving it out, like we have in our current healthcare system, where you can go to any dental office and you present your healthcare plan and they will pretty much turn you down, or you go into any hospital and present your dental plan and they'll pretty much turn you down, or vice versa. You go into any hospital or dental plan and they won't really know how to properly cover your mouth. It's absolutely insane to me, and it does not make sense that the most important part of our body is not covered. Here's just a couple of videos. You can find them as well if you type in Dr. Thomas Levy, but he talks about, he has a couple of books, and I highly recommend that if you're interested, or anybody really that, everybody has a mom, dad, grandma, or grandpa, but I mean, if you know anybody that is dealing with or has a root canal especially, or any infection in the mouth, then I highly recommend that these books, and it'll be very eye-opening for you and probably can save your life, so you won't have to lose someone in your family like I did. I love my father to death, and I really wish that he was around. Knowing what I know now, I would have gotten him the proper care and the professional care by getting him looked at and getting any infection removed, or getting that dealt with in the proper way. So anyway, this is something that we all take very lightly. I mean, I brush my teeth, I floss, and to be honest, there's sometimes where I used to skip it when I was younger, but now I do it religiously. I really make sure to brush and floss. And not just that, like, a water pick goes a long way. I don't know if you've all tried it, but water pick is one thing. I don't get paid by water pick to say this, but I've flossed, and I can floss like 5 times, 10 times at the same area and not get something where, and I just have a hard time at getting some of the very deep down things that get stuck in the teeth. But with a water pick and just, angled in the right area, I mean, it just really gets everything out. So I didn't mean to do a quick, water pick, promo, but you just want to properly make sure that your mouth is clean. And yeah, they say, oh, you can just get replacements or crowns or implants, but you really want to do the best that you can with their natural teeth. And this video is not really to get into, the interconnectedness of your teeth and how they're not just a bone and they're not just a dead part of your body. I mean, There used to be a point where, I know all the dentists know this, but a lot of the patients, everybody with mouth, they should know this, right? Like the history of the political history or the government history. I think it's good to know, and in some cases, it's important to know. But in most cases, it's just kind of cool to know. It doesn't really do much use in your life. I really believe, unless if you're getting into that kind of work, like politics and stuff. But everybody has a mouth, right? And the fact that we aren't properly taught the history on that, and what we did right and what we did wrong, is maybe something that we should look at. But anyway, I'll get off my I'll get off my pedestal for a second. So when you look at the two areas, you got cancer and heart disease. So really, you're talking about a lot of health problems in the chest area, but it makes sense, right? Because we got our heart here, where all of our blood and everything regularly, or I should say constantly, circles through, and it's going to basically sweep or bring in or carry through your body anything that's in the body, right? So if you have infection in your body, it's going to circulate through your body. It makes sense. Okay, but now the reason why I bring this up is if you look at cancer, you would expect, right, for the doctors, or our healthcare system, or at least the common school of thought, right? If we know now that at least 70% of, or more, it's actually more now, but let's just say 70%, because that's a very, that's a number that we can easily prove, and no one's going to deny it. But let's just say 70% of heart attacks and breast cancers are started by silent oral infections. That's at least more than half of them. So it's a number that we got to do something about, right? But if you look at the most common causes of heart disease, you would expect the mouth or the teeth or periodontal infection or gingivitis, like you'd expect some of that oral health care related stuff to be here, right? I mean, it's the cause of 70% or more of it. 7 out of 10, and I don't mean to beat this over a dead horse, but it's like you got 7 out of 10 patients with cardiovascular disease or heart disease that are caused by oral health. But if you look at every single pamphlet or information panel inside a hospital, inside a doctor's office, or inside any cardiologist's office, they seem to have skipped that part. And they want to then, prescribe drugs for the symptoms. Kind of odd. I mean, great for them, right? Great for them to sell their drugs and push the pills, but doesn't really do much to help you get healthier, right? That's kind of, I thought that was a point. But same thing, like, so most common causes of cancer, right? So we should see, right, knowing what we know now, we should see at least oral health or infections, right? We should see it as a factor. I mean, everybody knows that infection in the body is bad, right? Everybody knows that. It's just for some reason we've somehow managed to ignore or abandon the mouth as part of the body. That's the only thing that I can think of. Like, that's the only reason why we've allowed this to go on and progress as bad as it has, because infection is bad anywhere. Anywhere that you have something rotten, putrefying, and decaying, it is bad, right? I know everyone's all in the fermentation craze, and they're all into like healthy bacteria, but there is healthy bacteria and there is bad bacteria. There are good living organisms, and then there are viruses, and actually there's good viruses too. I don't want to get too confused or confuse you, but point is, let's get back on track. We would expect, if you type up the most common causes of cancer, knowing what we know now, right, that oral health should be smack dab in the front and center of this, or at the very least, it should be listed as one of the most common or potential causes, right? But the interesting thing is, they talk about sugar, they talk about stress, they talk about being inherited, they talk about could it be contagious? Can injuries cause cancer? But they don't talk about the main point. Again, just makes no sense to me. All it takes is just answering or asking yourself this very simple question. Oh, because that's another article. All right, so if I may, I will go back into the presentation here and make some sense of this. All right, so this is all people, right? This is everybody with teeth, a mouth, medical billing. I shouldn't say medical billing is the future. It's really medical billing for oral health care. Yeah, so sorry I have to kind of do that in the middle, but medical billing for oral health care is the future. And don't be left behind, because right now, I don't know if most of you know, for me, I lost my father, and it took that for me to figure out. But a lot of people are finding out. I mean, a lot of people know. A lot of people have like friends or family that have served in the military or one of the branches, and is a vet now. And veterans now. Arizona is changing that, and so I'm going to be talking about that in other videos. And I love what Arizona is doing. It's still proposed language, but the stuff that they're working on, being so progressive and really working on doing the right thing for veterans, I really have to commend Arizona for a lot of the things that they're doing to clean up even the homeless situation there. But I don't want to digress too much. But the point is that we all know that the mouth is part of the body, and that health starts in the mouth. But if you go into any hospital system today, or if you go into any dental office, you have this very weird, let's call it a gap, right? You have this divide as far as coverage and even understanding. I mean, goodness, even if I ask 10 people what dental even means, including dentists, nobody seems to agree or have the same idea on what that is. And I think that's a very big problem, right? So when it comes to moving forward with the system, the thing that I think will make it very simple, just to kind of cut to the chase here, is that, dentistry, you can think of it as a separate thing, but, maybe leave some comments or let me know or reach out to me and tell me if there's a better way to understand this. But the mouth is clearly part of the body. So it's like the easiest way to think of dentistry is it's not this, alien animal specialist that just carves ceramic, porcelain, veneers, and that's like all they do, and then just fill you with cement, and get your teeth well. There's this whole area of the body that is currently underserved and does not have proper coverage or care for, and we're talking about the entire mouth, including the teeth, because with dental coverage, everybody knows dental coverage is not enough. Even people with the best dental coverage, once it might be good until you're 30 or 40, but especially when you start getting up into 50 years old and 60 years old, dental insurance doesn't do anything to cover your full dental needs. But it was never designed like that in the first place. People forget dental insurance is and always should be a elective supplemental insurance. So meaning healthcare covers your body, the medical insurance covers your body from head to toe. That's what it was designed for. That's what it's intended to do. That's what we pay for. Somehow, some way, patients started to be okay with, because some insurance company just, and I don't know if this was on purpose, but what I can picture happening in my mind is some insurance company just thought, oh, it's dental, we can exclude that legally, or we can exclude that regulatorily, because everybody knows the mouth is part of the body. Having a dental exclusion to not pay something doesn't make sense. Maybe to reclassify it so another part or another another part of the system can take care of it, but to exclude the mouth completely, especially the most important part, made absolutely no sense. So I think it was just a misunderstanding. I don't know if somebody else could shed some light into this, but point is I think we can all agree it does make no sense where we have something that says, oh, we'll be covered from head to toe for our health. And then you go to the doctor or you go to a dentist and say, okay, well, I have a health problem and it has to deal with mouth, and say, oh, well, that's dental. It's like, okay, so who made up dental, and what does dental even mean, right? And I ask that question because there's no answer to it, unless if you understand that dental is medical. It's just simply a specialty of medical, and of course the mouth is part of the body, so of course dental is just part of health, right? I mean, and it's very simple when you think about it that way. But the reason why I bring that up, and it's such a big deal, is because 99% of dental offices do not currently properly take medical insurance, which is silly, right? So dentists are expecting to do all this work, and they look at you when they, say it's $30,000 for your new set of teeth, or $50,000 for your whole mouth, and they look at you like you're, the one with the problem, when in fact they're not doing their job, and they've forgotten the biggest and most important part of this whole, system, which is the medical and health component of it, right? I mean, yeah, if they just treat you like you're just a set of teeth walking around, and they charge you $50,000 for it, and you don't like that, and you get a sick taste to your stomach, I don't blame you. And sorry, docs, I know I work with a lot of you guys, do great work, and I'm not talking to any of my doctors, of course, right, or any of my clients that really do this well, but I'm talking about all the doctors out there that don't even, really recognize that the rest of the patient is out there. And I know a lot of you patients, you've seen and felt this too, and sometimes if you don't feel like there is a second opinion or another doctor out there, I really feel for you, because I've been a patient, in the chair, and and that's the last feeling you ever want to have. You want to feel that you're taken care of by people that you can trust, not some business or someone that's trying to make money from you. And that's the problem that we see in healthcare way too often, is not just in dental offices, is in the hospital system too. And I'm not saying that there's anything wrong with making money. Of course, money is up there with oxygen, so we all have to do it. We all have to make it, right? It's very important. But with healthcare and with practices, I do believe we're in a very unique segment where if there is any business that should get help, goodness, it's not the banks, but it is the healthcare system from the government. And the reason why is because we do so much to pay money to the system, the government, right, to pay for our roads and our utilities and all that, and that's all fair and are fair and makes sense. But the health is what the government relies on, right? A healthy working population. So it just makes sense to me. But anyway, again, I'm not a politician, right? So let's get off of that subject and get back on track. But I digress. If you have not already noticed, I get off track many times. I'll try to do the best I can to stay on track. But anyway, so when you go into any hospital system, what happens is same thing, right? They won't cross that vermilion border. So it's this weird insanity where, and actually I could pull up this other slide, but there is case after case after case of people with swollen infections, and they will come in. Let me see if I can actually find it. Saving lives. But people will go into the ER and they have swollen infections, and they really should have gone to a dental office so they can get their implant, or not their implant, their tooth pulled so they can get their infection drained, right? The source of the problem. Because once that happens, all of the swelling and the infection goes. I'm not saying in every case, but in these particular cases I'm thinking of where there's just huge, massive infection, it's so bad that what happens is you almost see like a baseball on the side of their throat. It can actually get so bad where it starts to press on their windpipe to the point where they can't breathe, and they have to punch a hole, like they do a tracheotomy, and they punch a hole through the air pipe. Now, I'm gonna just break here for a second. This is something that happens every single day inside a in an ER and hospitals all across the U.S. and even across the world. But all it takes is for me as a patient to see that, to know that there's something wrong in that situation. Now, I've seen the movies where somebody gets like, they get karate chopped, or they get hurt to where they cannot open their their mouth, or something happens where they get crushed and they have to do a tracheotomy. That may make sense. But for people to do a tracheotomy because there is a completely 100% avoidable and unnecessary non-emergency procedure that they could have done in a dental office, or even just with any doctor if they would have just crossed that Vermilion border. So like they're all trained to do it, or I should say they're all trained to do it. The mouth is a specialty and it does require special training. But what I mean is they're all doctors and they're trained in infection, and they easily could be trained doctors to do work in the mouth if they just take a little bit more schooling. And dentists clearly have all of the skill set, but they're not in that ER setting or that hospital setting in most times. Now I know hospitals are getting better, but I remember I've seen articles where it was as bad as like 60 or 70% of ERs and hospitals did not have a properly or fully staffed dental department or oral surgery department. They would have an oral surgeon here and there. So anyway, I would say the biggest thing is, number one, is identify and position in front of the trend. And the reason why I say that is because, you want to get a relationship with not just like your dentist, because goodness, hopefully you have a good relationship with dentists and you have a good, healthy, long oral healthcare, track record and history, because the best condition is when you just keep your natural teeth and you're in a healthy situation, right? But what I mean is identify and position yourself in front of the trend. So we know what's going on with oral health care. We see this shift where everybody knows that not treating the mouth is causing a whole slew of other problems. But not just that it really is the mouth. But go figure, right? It's where health starts. It's in the mouth. And any infection anywhere in the body is going to cause, a problem. So number one is just realizing that, right? So not just for other people around you, friends and family, helping them understand like the information that you just understand here today, right? But it's to get in front of the trend. It's not to just sit around and just accept whatever, powers may be and whatever government handout or whatever insurance company and whatever codes and processes they want to cover. What I'm trying to say is let's get in front of it a little bit and let's realize that yes, although, we do have a lot of great information here, we have to go that one extra step to put it in action and use it the right way. So meaning if you have a Medicare card or if you have a health insurance card, there is things that you can do to get coverage at a dental office or by a dentist for the work that they're doing for all of the health related or all the medically necessary procedures that they're doing for you, right? And this may not sound like the sexiest thing or the most exciting thing to talk about, but for me this is very important because if I knew what I knew now, my dad would have lived a lot longer than 62 years, right? And I truly believe that I'm doing this for a very, very important reason. And so more 30-year-olds, or I wasn't even 30 at the time, but more sons don't have to bury their father before they're 30, basically. Number two is to think healthy, talk healthy, and become healthy. Everything may be just as simple as, making that choice, right? So right now you may be in a situation yourself or you may know somebody that is in a perfectly healthy situation. And if that's so, don't take it for granted. That is the best time to be in, and you really want to do everything that you can to keep your health in that state. They say health is your wealth for a reason, because trust me, all it takes is being sick one day to know how much it affects you and your well-being and your state of mind. So just thinking healthy, talking healthy, and becoming healthy. And number three is focus working on your health and not allowing the problems to worsen, because what's an elective today, there was this quote that I heard. It says, what's an elective today is an emergency tomorrow. And really, almost all these things, I mean, I'm not trying to say that we're going to prevent death, but what I am saying is that dental is a lot more medical than we know. And dental does save, or could potentially help better the quality of and help save the suffering, right? Or the needless suffering, I should say, the chronic suffering that a lot of people go through as patients for other parts of their body, when really the original source is the mouth, right? So is your oral health up to par? The biggest thing I got to say about this is a fast moving field, right? There's been no other part of healthcare, in my opinion, that's increased more than the dentistry or the oral healthcare field. The advancements, I mean, yeah, it's just incredible technology and robots in every area, but that's just like an industry-wide thing. But what I mean is the amount of technology they've gone through with implants, prosthetics, with imaging, with AI. It's just incredible. So what I'm trying to say is it's very hard to find a knowledgeable doctor or a knowledgeable dentist on all the areas of this, but this is the most important area of your body. So, it would be wise, it would be prudent to get, just like, you would get a couple of coaches for your basketball, is to get at least a very knowledgeable doctor. A biologic or a holistic doctor isn't required, but there is a reason why they go through more schooling, right? And so you want to find doctors that are highly trained, that have the right licenses to do the work, that have the right credentials, and they have the right training and experience, most importantly, to do the work that you're looking to get done. And yeah, just put that as a priority. Sometimes we just miss out on what that might be. All right, so what I'm going to do is I do want to have a quick form that I'm going to share, and this form is for any patients out there that are wanting to find a practice who can help you get covered for your dental treatments or oral health needs. We help specialize, working with dentists that are medical, or I should say Medicare providers, and they take medical coverage. They understand that the mouth is part of the body, and they understand that health starts in the mouth. And so if you have any, medical necessity, or if you have any health needs that start from the mouth, which goodness, I mean, we all do, if you have any issues or concerns there, that, you should find the right provider for that. You should find the right dentist or doctor that's trained. So what I'm going to do is I'm going to, just because I know this is kind of small up here in the corner, but what I'm going to do is make this slide right here and go ahead and type that in. So this is the website. You can go visit here. I know it's the 22nd today. So it's onemedall.typeform.com/TO/ and it's PXEG, so Paul, X-ray, Echo, George, and I don't think it matters, but it's just a capital G and then a B as in Bravo 30. So that's onemedall.typeform.com/TO/PXEGGB30. If you put that into your browser or your smartphone, you should get a form like this, and you just have to hit start, and then it'll ask you for information. So you can go ahead and put that in there. If you submit any information here, this will get sent off to our scheduling team, and one of our health planners will be out to reach out to you, and they could help answer any questions about getting you connected to a doctor or help finding a dentist in your area. Anything, or maybe it's just a general question, regarding your health. I can't promise that they know everything. They're not doctors, but this is exactly the point, is to have a health planner or someone that you can maybe bounce ideas off of, or maybe just share your story with, share your experiences with, or maybe you just want to talk your situation through with somebody to get a second opinion, right? So that's what the health planners are designed to do, and really they're becoming experts on, because they see many patients from many different walks of life, and as they see these patients coming in, that are taking these different treatments, they see what's working well, they see what's not working well, and they see what doctors and what treatment plans work well for certain procedures, and maybe what would have worked better in some certain procedures. So it's really good to have, I believe, that second opinion, and especially one that isn't from the doctor doing the work. So that's why I love having a health planner. If you'd like, again, I can put up that website. You just go here and you can have one of our health planners reach out to us. Of course, you could always call our company and our website. So anyone that doesn't know where that is, that's onemedall.com. You can call us on our company phone number, which is 408-444-8779. That's 408-444-8779. You can, of course, contact us at support@onemedall.com. And I think that is it for today's presentation. So I'm signing off, and we'll see you on the next video. Take care, and just remember that health starts in the mouth, and the mouth is part of the body.